All of the simple tasks that we do from day to day, putting on socks in the morning, making coffee, brushing your teeth, all of these simple tasks that we take for granted can one day be taken away.
Previously having energy to carry out daily tasks, and now it takes so much effort just to get out of bed in the morning.
Being young and healthy, and all of a sudden being diagnosed with such a debilitating disease that will affect the rest of your life.
No longer being able to provide for your family, not being able to go to work.
All of your favorite activities and passions, all of the things that you once loved to do, and now you're no longer able to participate in them.
Having a disease that doesn't just affect one part of you, but every single aspect of your life.
Living with this disease and just knowing that it's not going to go away, because as of yet, we don't have a cure.
MS is the most common, non-traumatic neurodegenerative disease in adults. It affects 2.5 million people worldwide, with Canada having the highest rates. This disease is most often diagnosed between the ages of 20 to 40 years and has lifelong implications. Although people are diagnosed with the same disease, the progress, severity, and symptoms of MS vary greatly from person to person.
Multiple sclerosis is a chronic inflammatory, demyelinating, and degenerative disease that affects the central nervous system. It is an unpredictable and disabling disease which can cause a wide variety of body function impairments and activity limitations. Oligodendrocytes myelinate axons in the central nervous system, which facilitates the transmission of action potentials. Symptoms of MS result from the inflammation and breakdown of myelin, the fatty protective coating surrounding nerve fibers of the central nervous system. In MS, myelin is destroyed and myelin repair is prevented by the formation of hardened sclerotic tissue that can appear in multiple places within the brain and spinal cord. Loss of myelin interferes with the transmission of nerve signals and triggers the wide-ranging symptoms of MS. This loss of myelin is referred to as demyelination. There are 4 identified types of MS. The most common is relapsing remitting MS, which affects approximately 85% of MS patients. This is characterized by its unpredictable episodes and attacks where either new symptoms appear or existing symptoms get worse. The other types of MS include primary progressive MS, secondary progressive MS, and progressive relapsing MS.
Because of the complexity of this disease, the cause is not completely understood. It is believed that there is no single cause of MS, but rather a disease that results from a complex interplay of genetic and environmental factors that are unlikely to be the same in any 2 individuals. 3 main hypotheses have been proposed. The most supported theory is autoimmunity against the central nervous system. This results in dysregulated immune response. The second hypothesis is an infectious cause, and the third, a primary degenerative process affecting oligodendrocytes. These hypotheses are not mutually exclusive, as a primary viral infection can trigger autoimmunity or cause degeneration. Potential environmental causes of MS have been suggested due to the occurrence of more diagnoses in areas of higher latitude. Recently, vitamin D deficiencies have been recognized as a possible risk factor in MS.
MS interferes with daily activities and has a negative impact on well-being and quality of life. There are a wide variety of symptoms that affect every individual diagnosed with MS differently. Symptoms that affect the daily lives of MS patients include fatigue, spasticity, muscle weakness, ataxia, tremor, decreased balance, bladder, bowel, and sexual deficits, visual and sensory loss, and neuropathic pain. Aside from the physical symptoms, MS has significant social and psychological consequences as well. Major depression affects 1 out of every 2 MS patients. 50% of patients with MS have cognitive dysfunction. These include speed of processing information, short-term memory, concentration and attention, problem solving, visual spatial abilities, and verbal fluency. Cognitive impairment may be the most devastating symptom for patients and their family. As this disease evolves, quality of life deteriorates, and patients gradually withdraw from social activities, give up on hobbies, minimize their interests, may lose their jobs, and need more assistance, becoming dependent on their caregivers. Relationships with family members and friends are affected. People often divorce and experience loneliness. The disabling nature of the disease causes multiple consequences to each individual regarding their physical activity, psychological aspects, and social interplay, and also creates burdens for their families and social environment.
Even though there is no cure for this disease, there are many strategies to help minimize symptoms. Treatment options for MS can include rehabilitation, psychosocial support, medications, and surgical procedures. These treatment strategies all work together to try to increase a person's quality of life. They can work to slow the disease, but the goal of treatment is to control symptoms and help maintain a normal quality of life. Early intervention can play a key role in the management of the disease. Medications are often used to lessen the effects of specific symptoms. However, these medications can create complications due to negative side effects which can worsen other symptoms associated with MS. Groups such as the MS Society and Myelin Repair Foundation work to provide support and fund research to find a cause and cure for this disease.
It is important to create awareness of MS because of its high prevalence, especially within Canada. We want to create awareness. We want to find a cure.